Hi, I am Dr. Kristy Nitz, Carrollton OBGYN. I'm a board-certified obstetrician and gynecologist. I can't tell you exactly the reason why I wanted to be a doctor since I was 3 years old. My grandfather bought me one of those Fisher-Price doctor kits, and I was hooked. He was my first patient, and he'd be like, "Oh, Kristy, don't give me a shot, Kristy." And from that point on, I've always wanted to be a doctor. But then my aunt, when I was 14, had a preterm delivery at 28 weeks. And before that, she had spent 4 weeks in the hospital. And so I heard a lot about her obstetrician and the things she went through. And so that got me thinking, obstetrics may be fun. And then when I got into medical school and I learned that I loved doing surgery, and as an obstetrician, I can do primary care and surgery, that kind of cemented it for me. What I enjoy most about being a women's care physician is that I can take care of women in all aspects of their life. Especially now that I'm going into my second decade of being here, I'm seeing some patients that I took care of when they first started and getting their pap smears. I've helped them become pregnant. I've delivered them. We've gone through things together. I'm most passionate about women understanding their bodies and owning their bodies and wanting to take care of their bodies. I always tell them, you only have one you. Doesn't matter what other people want to do to your body or say about it. You have to take care of you, because at the end of the day, you're the one who has to live in this body, so you want it to be as healthy as possible. My approach to patient care is I try to be approachable. I think if patients feel comfortable with you, they're more prone to share things with you. And it's only with the patient being open and communicating and sharing that I can really address some of the deeper problems and make sure I'm treating the right thing and doing the best care for them. I like to explain to the patient why I'm doing what I'm doing or why I'm ordering certain tests. And I always like to have the patients leave with educational material, because I know a lot of times you get home and you have questions that you didn't ask. So if you have the educational material, you can look up for yourself. The types of conditions I treat run the spectrum of women's healthcare problems. I treat everything from primary dysmenorrhea, which is painful periods, to amenorrhea, not having periods. I treat infertility. I treat fibroids. I treat heavy bleeding. I treat postmenopausal bleeding, uterine prolapse, cystocele, rectocele. As a gynecologist, I perform a wide variety of procedures, from minimally invasive procedures such as endometrial ablations and corrections of stress incontinence to more open procedures such as hysterectomies, both laparoscopic and open. Of course, as an obstetrician, we perform things like cesarean deliveries. We also place cerclages. I like being a physician at Tanner because I like this community. When I was coming out of residency and looking at communities in which to practice, I wanted a community in which I felt like I could be helpful, that I was needed. And I just like the fact that I walk around town and I get stopped and patients are like, "Hey, you delivered my kid." That's one of the reasons I like being an obstetrician. So when they come in for something happy, I want them to take place of, "Dr. Nitz made this even more awesome." If they're coming in for something less happy, or like a cancer diagnosis, or I have to tell them they have an STD, I want them to say that Dr. Nitz made this more tolerable, that she was compassionate and she helped me through this.